What happens in Vegas should be masked. The Southern Nevada Health District is recommending everyone wear masks again when indoors and in crowded places, whether they have been vaccinated or not and whether they have tested negative or not. The number of COVID-19 cases is on the rise in Las Vegas, Nevada, as is the case in many destinations across the country and around the globe. This is not an official requirement, as only the state, county, and cities can mandate that. The mask recommendation came after health officials reported yesterday 938 new cases statewide, the biggest one-day jump since February, and 15 new deaths. This strong recommendation affects casinos, concerts, and clubs where business has boomed since restrictions were lifted and the state fully returned pandemic control measures to counties about 7 weeks ago. Both vaccinated and unvaccinated individuals should wear masks when they are in crowded public settings, such as grocery stores, malls, large events, and casinos, Dr. Fermín Leguin, the region's chief health officer, told reporters. Vaccine clinics and testing are continuing at sites around the region, Leguin added. Vaccination rates have stalled in recent weeks in Nevada, a state with libertarian leanings, where health officials reported Friday that about 55% of residents 12 years and older have received at least one dose of COVID-19 vaccine. Statewide, about 46.3% are fully vaccinated. Nationally, 68% of adults have received at least one dose of vaccine, according to the Centers for Disease Control and Prevention. An official with the union representing 60,000 Nevada casino employees issued a statement noting the risks posed to workers by people who are not vaccinated. Culinary union official Gioconda Arguello Klein pointed to CDC data that more than 97% of people who have been hospitalized recently with COVID-19 have not received a vaccine. It also followed a call from the public health chief in Los Angeles for Californians to rethink plans to travel to Nevada until COVID-19 case numbers in the Silver State decrease. Weekend visitors from Southern California have in recent months jammed Interstate 15, the main route for the 270-mile, 435-kilometer trip between Los Angeles and Las Vegas. I do want to recommend, especially if you're unvaccinated, reconsider traveling to places where the 7-day COVID-19 case rates are increasing or high, like Nevada. Our neighbor, Dr. Muntu Davis, told Los Angeles County Commissioners on Tuesday. Nevada Governor Steve Sisolak's chief of staff, Michelle White, responded during a video conference call with reporters on Thursday with a suggestion that people travel to Nevada and get vaccinated. That's why we are working to make sure there are vaccination and testing locations located on places like the Las Vegas Strip. That is open any individual, workers, visitors, White said. We have all 3 vaccines offered, including the one shot. If someone is coming from out of state, that can be more convenient, and we certainly encourage everyone to do so. The Department of Health and Human Services said test positivity, a key marker of the percentage of people found to be infected among those tested for the virus, had tripled from 3.4% 5 weeks ago to 10.9% on Thursday. The positivity figure reported by the State Department of Health and Human Services was 12.3% in the Las Vegas area. The number of new cases reported Friday in Nevada was 866, and 6 new deaths. That brought to 5,758 the number of lives lost in the state to COVID-19 since March 2020. Most cases and deaths in Nevada during the pandemic have been in the Las Vegas area, home to 2.3 million people and host to tens of millions of visitors per year. Rebuilding travel.